Cervical cancer remains one of the leading causes of mortality and the second most common cancer among women in Sierra Leone. In 2020, the Ministry of Health, the United Nations Population Fund, and the People's Republic of China launched a 4-year initiative focused on reaching vulnerable women at risk of maternal mortality and cervical cancer. Meet Bintu, a courageous woman who has undergone screening and treatment for cervical cancer in one of the facilities supported as part of the South-South Corporation. Like many others, she faces obstacles in accessing healthcare and information.
Sometimes facility go there some side, but that challenge is for come up from the place to that for going to that side. Now one thing is very difficult because as a disabled person, people can always take and say we're difficult for deal with this community where we in a disabled home. So they announce say health people they don't come for talk to we. So we all rush for good on day. They come now with community and let we not get a fear. Woman then will get sick then where they don't understand water and they know they go for checkup all the time. So they come for help for let go do free checkup for let we know we status. Oh, reach that day. The nurse system receive we, talk to we. Before then they begin they even take for go check we. They be sensitized. We say let we not worry, let we not fear. Not so anything when a big thing, then get machine where they really then they really check we with for know the status where we dey.
For Bintu, accessing healthcare as a person living with disability was very challenging. Despite the challenges she faced, Bintu was reached with cervical cancer awareness messages in her community through targeted interventions and community outreach. This effort empowered her and many women in the country to take proactive steps toward their health and well-being as they gained access to life-saving screenings and treatments for cervical cancer. Bintu's story is just one of many unfolding within these walls. For the past 4 years, the Princess Christian Maternity Hospital, Sierra Leone-China Friendship Hospital in Joy, King Harman Maternal and Child Health Hospital, the Bo and Makeni Government Hospitals, the Lakka Ogoo Farm, Town, Ross Road and Regent Community Health Centres, supported through the South-South Corporation Assistance Fund, have been a beacon of hope for women, providing cancer screening to nearly 8,000 women, including Bintu. Through the joint effort of UNFPA, the Government of China, the Ministry of Health, these health facilities were revitalized, refurbished, and supported with equipment. Healthcare providers trained and communities engaged in vital conversations about health. This partnership also allowed the Ministry of Health to provide cervical cancer prevention and treatment services for the first time in Sierra Leone.
During the course of this training, we learned a lot about the new techniques using the colposcopy machine and also learning the characteristics of the pre-cervical cancer lesions.
We are actually seeing other women who are coming with overt cancers now, bleeding and all. And it's very devastating seeing those women. But with this project and with this program of screening and treating, we are ensuring of preventing many women and girls against cervical cancer.
Through this initiative, we've collectively been able to contribute to a number of important achievements, including in strengthening national policies and strategies, including in building capacities, including in expanding access to services.
This partnership has been very vital to the ministry in terms of supporting our efforts to enhance cervical cancer prevention and management.
China will definitely continue to work together with Sierra Leone and OH and the various partners to improve the health care and the well-being of Sierra Leone people, especially for the women and their children. Thank you.
Well, I just want to say thanks to UNFPA and government and Chinese government, with your government, we come together with all the donors